Hello, come on into All Things Odd. I'm Dr. Natalie Phillips.
I'm Dr. Hannah Galloway.
I'm Whitney.
All right.
This is our YouTube channel. So how many subscribers do we have? Oh, there's me.
Oh, that's cute with the that one was cute with the stocking.
You know, like 69. That's pretty good.
I missed that day. That's cute.
Yeah. So this is where you can find all of our past videos that we've done. We had to take a couple weeks off, I think, but we're back now. But if you missed us, or if you ever are missing our show, this is where you can go. There's different thumbnails that have different topics on it, so you can kind of pick and choose what you want to learn more about. But it's a really good option. It's also a good option if you know someone who would benefit from watching one of our videos that maybe doesn't have social media. You're able just to actually text them the link to the show, and then they're able to watch it. But we have a lot of great videos. I just learned that Dr. Galloway and Dr. Phillips have been doing this for like a long time. So I didn't realize it's like 10 years or something. So very
this
cool.
Is our second iteration, but all the original content was deleted. Well, it got removed from the internet because that business is no longer open. So we kind of just restarted, but it was probably necessary because how much tech has changed, even just with cameras and stuff. I would bet if we could go back and watch those old ones, we'd be really embarrassed about it because it's probably like grainy and sounds bad. But you know, we learned. So
yeah, we had a lot of good stuff out there. But we can definitely cover something again because like Dr. Galloway said, things change a lot. So again, if you are watching and you're wondering if we have covered that topic, head over to our YouTube to those that playlist that we had earlier and kind of search there. If not, send us a message. You can reach out to us on YouTube, Facebook, Instagram, LinkedIn, if you look one of us up, and send us a message and say, hey, did you guys ever think about covering this topic? And we might hit it up. And we'll thank you publicly because we always like to give credit where credit is due. So that being said, first of all, before we head into our topic today, I just wanted to say thank you all for the support. We have launched our new nonprofit, ACNC Cares. We're going to talk a little bit more about that at a later time as it starts to develop. But we just started to get the social media handles and everything in place. And we are starting to build out the website. We're starting to create things where we can have our first board meeting. So if you are tuning into this, we just wanted to say thank you because we've been getting a lot of great support on all the different social media channels of just starting a nonprofit. And so be patient with us as we continue to get that going and growing. And we will definitely come back and share that on another show with you of where we are and what our plans are. But for now, you can follow us on Facebook and Instagram. And pretty soon we will have our website as well. So with that, we are going to tackle a topic today that is going on because it's Tinnitus Awareness Week this week. And so honestly, Tinnitus Awareness Week is just for us to kind of talk a little bit more about it with people to start the topic. It runs from February 3rd through 9th of this year. And during this week, different organizations and healthcare professionals and individuals just kind of work together to provide the information about tinnitus, maybe offer support and resources, and promote strategies and just helping you manage the condition of having tinnitus. And so the history of Tinnitus Awareness Week, it was established to address the lack of understanding and awareness surrounding tinnitus. And it serves as a reminder that tinnitus is prevalent and that it can significantly impact a person's quality of life. This week just allows us to have this platform to join in on the advocacy and the support and the research efforts aimed at improving lives affected by tinnitus. So a lot of our colleagues, if you've seen different businesses and different social media platforms, a lot of our colleagues actually dined at Texas Roadhouse on Monday. And Monday was a special day to eat there because there is a history of tinnitus with I believe the owner. And so just to kind of support that, a lot of the proceeds were going to go to the American Tinnitus Association. And so a lot of our colleagues had dined there just to kind of help with their support, took their office staff there as well. And so we wanted to kind of hop on in our weekly show. I know we haven't been here for a couple of weeks because we've been traveling and been busy doing some other things, but we wanted to hit tinnitus up this week, especially during Tinnitus Awareness Week. So with that, we're going to go through a couple of things. And the first thing that we're going to talk about, and again, if you're watching this for the first time, join in on this question, put it in the comments. What have you learned about tinnitus that you find interesting? So as we go around and talk about what we found interesting, if there's something interesting that you've learned or would like to share, please put it in the comments, whatever platform you are watching this on, so that other people can learn as well. So I'm going to kick it off, just preface it by saying we want to make sure that people understand that if you go in and see a physician or you see another provider and you are told that nothing can be done for tinnitus, that is not true. There are a lot of things that can be done about tinnitus. And just this week, we had a couple of patients come in that told us that that's what they heard. And so we just want to kind of start off and kick off today's episode with the fact that there is something that can be done. And if you don't take anything else from today's show, except for that point, that is probably the best point to pass on and allow people to see that there is something out there for people. And so there is something that you can do for tinnitus. Do not believe if you are told by a physician or other professional that there is nothing that you can do for your tinnitus. What I've learned in my training is that statement is actually negative counseling, allowing someone to not really be aware of possible opportunities. And so it creates tinnitus into something that they think is a negative thing because there's nothing out there, or maybe there was something out there and it didn't work, or maybe they're not doing research on it, or maybe they did do research and it just kind of fell flat. And so telling somebody that there's nothing that can be done is not a good thing. Reach out to your local audiologist and find out what they have, or if they have people that they would recommend for help with your tinnitus. Okay, so back to the thing that I've learned about tinnitus that I find interesting is that there are many therapies out there and it just keeps on evolving. So when I started to look at tinnitus therapy back maybe 25 years ago, there wasn't anything that I could find that you had a particular certification. So 25 years ago, my fellow audiologist and I, she lived in another city, but we were dedicated to figure out how can we be certified into helping people with tinnitus. And the only thing that we could find was tinnitus retraining therapy. And that was created by Dr. Pavel Yastrobov. And that we went to a training for 3 days, and it was pretty intense, but I absolutely loved it because not only did I learn about tinnitus retraining therapy that can help tinnitus and sound sensitivity patients, but also that it's been around since the 1980s. So going back to that first thing that I talked about, as there's nothing that can be done, there has been something that actually has been proven, research proven, back to the 1980s. And how many decades is that? That is like 40 decades, isn't it? About.
Four.
So not 40, 4 decades. Sorry.
40 years.
A long time ago. 4 decades, 40 years, which is crazy to know that. But we just wanted to pass that along. And since then, like I said, therapies have been ever evolving. So there have been things that have come out that may have had a less success rate in reducing tinnitus awareness and disturbance, more success rate in reducing the tinnitus awareness and disturbance. And just there's constant providers that are trying out some different things. And so we would recommend, number one, that you find the place to get help and the right professional. And what that means is, I just want to say this out loud in the nicest way possible, but just because you have the term tinnitus in your practice name, it doesn't necessarily mean that the providers, all of the providers in that practice, have been trained and offer a comprehensive and research proven and reliable treatment plan. And to me, that's really, really important. And so, yes, you can start the process, but further than just looking at a practice name, you also want to be able to have maybe a meet and greet or talk to the actual provider or professional doing it, to make sure that they have been trained to be able to help with tinnitus. And I'm talking about people who not necessarily have it, but then they go about their day and they forget about that they have tinnitus. But it's the people who it's starting to affect their sleep patterns. They're bothered, throughout the day with their tinnitus, and it's getting pretty distracting. And so those are a little bit further than, oh yeah, I have this sound, but like I go about my day and I forget about it. These are the people that actually need that evaluation and possibly that management. And so, number one, find the right place to get help and the right professional. And knowing that, just know that there are audiologists that are out there that are very passionate about helping people with tinnitus. And there are ones that are not very passionate. Like they will actually cop and say, yep, that's not for me. Go see this particular professional or this audiologist, because I know that they're really good at what they do and they do this and they love working with tinnitus patients. So that's another one. So again, this will come up a little bit later, but a research to find these passionate audiologists and who have had history working with these patients is going to a website. You can go to the American Tinnitus Association, the ATA, which we're going to put that website up there. You can also go to where I got trained with tinnitus retraining therapy and go to tinnitus-pjj.com, and I'll put those up as well. So just to kind of let you know, that's something that I learned, that there are multiple treatments out there, multiple things going on. Find the right person, find the right practice that can help you. All right, so we're going to pass it on to Dr. Galloway.
Yes. So hearing you talk, I thought about a couple things. I think too, a lot of patients end up coming to see us and their primary complaint could be tinnitus, on the appointment. That is the reason that they have scheduled. And if you're not addressing it, or you're not, speaking to it, or you're saying that there's nothing that we can do, you're just really dismissing their problem. It was bothersome enough for them to get up the gumption to come in and get a test and tell somebody about it, and they're worried about it. And I feel like people have just felt really dismissed about it. And when you have a greater understanding of what it is and where it comes from, maybe you could relax about it a little bit, maybe not. But I think it's hard for patients when they feel like they've just been dismissed, whether it's by a primary care doctor or an ENT or another audiologist that just said, oh yeah, your hearing's normal, it's fine. But we certainly can help patients with that in our office. Dr. Phillips sees most of our tinnitus patients, and we're able to kind of offer some more telehealth now, which is exciting for tinnitus patients, because a lot of times there might not be an expert in your area, or, you might not be able to travel to see somebody. But with telehealth, that's really kind of changed the game on things like that are more therapy related. So you can always reach out to us too if you want to talk about doing a telehealth visit for tinnitus. But what I found that's really interesting, it is new since I graduated, and I sent the article to Dr. Phillips. The article I sent to her is from NIH, so the full PDF is available. You don't have to have a membership anywhere. But it's essentially a new technology that's being used to measure tinnitus. And giant disclaimer, it's only investigational at this point. So no one in their office is actually using this and treating patients yet. But the research is really exciting. And so what it is using, let me get my notes here so I can make sure I say the right thing. Okay, so what it's been using is functional near infrared spectroscopy. And it makes the use of a specific interaction of light with biological molecules to non-invasively measure relative concentration changes of hemoglobin in cortical regions of the brain. So essentially, lots of words. But I saw pictures of them doing it, and they had patients, and the patients were wearing a cap that looks like, an electrode cap, what we would use to measure from the brain. And they were getting this information, and there's a machine. The company that makes it is called NIRX. And I'm sure that they're mentioned in this article. But that's the company that makes the machine, and they're using this. And if you look at this article, pretty much there was a statistical significant difference in the connectivity areas between the brain and people with and without tinnitus. So it's an actual way to measure tinnitus or benchmark, how someone's doing and if they've seen improvement or not. So for us, an audiologist, this could be really, really exciting. Like if this is something we could add to our practice way down the road, that's really cool because it's a way of mapping it to the brain and saying, this is being able to kind of change it and measure it in a way other than the patient just saying, well, I think I'd rate it, this way on my questionnaire, or, just kind of giving like a 1 to 10. So I didn't read this full article, but I'm very interested in it. And I got on the manufacturer's website that makes the equipment, and it did have a big disclaimer. Right now, it's just investigational. So you can't actually see anybody for this yet. But I think there's a lot to be excited about, because if we can measure it accurately, then, we can make better data predictions and be able to make changes in people's lives. So feel free to read that full article, but something that I'm excited about, that there's actually a way coming, to be able to measure it.
That's
Awesome.
cool.
I'll see if I can try to figure out how to get this article in our comments here.
Yes, there's a PDF available. I think the email I sent to you, I attached the PDF. But there's also a hearing review article. That's where I originally found this. And the hearing review article is called New Technology Can Measure Tinnitus. And it's like a 1-page read, but it's really, sort of condensing it to tell what it is and kind of what they found. But it's definitely an exciting beginning for tinnitus,
Cool.
I think.
Yeah, that's a cool find. All right, Whitney, what did you find?
Okay, so this is just something that I learned about when I had my tinnitus course at UNC in Greeley. And one thing about tinnitus, the course at tinnitus, it's a 1-week class, but it is like all day. It is like the most gruesome week of your life. Dr. Galloway might.
I did it too.
It was like that
in
for
the
you.
summer.
It was so crazy, but it was so informational. And I think one of the cool things that I learned about while taking that class is, there's different types of tinnitus. And I think when we think about that at first, yes, there's that subjective tinnitus that you're only hearing, and it sounds different from everybody. Some patients tell me, well, it's not really tinnitus because it's not like a ringing in my ears, but I have like this whooshing sound, or I feel like it's crickets or bells or things like that. And yes, that is actually still all considered tinnitus, but there's some other types of tinnitus that are more rare. And one of those is actually objective tinnitus. And so that is tinnitus. It's rare. I've personally not seen it. I do have a classmate who is at a placement where they actually did have a patient that had this, but objective tinnitus is a rare form of tinnitus that can be actually heard also by another individual, such as your healthcare provider, using special tools. So that's different. So like most patients, when they say they have ringing in their ears, obviously we can't hear it, but this you can. And so it's usually from an actual physical source. So sometimes it's a vascular abnormality. Sometimes it's something going on with muscle spasms. Sometimes even issues with the middle ear ossicles or the bones that we have. And it usually is a little bit more rhythmic to it because it follows like either the blood pulsing or like a muscle contraction. But it can kind of be some red flags for us in terms of, if we need to go see a different medical provider. So yeah, sometimes it's vascular middle ear issues. Sometimes it can actually be like something called a glomus tumor where you feel like it's pulsing with your heartbeat. Sometimes it can actually be more somatic, involving like your jaw, like if you touch your jaw and things like that. But it's just very, very interesting. So things like that can be done for that is a provider can listen with like a stethoscope or something. Sometimes apparently it's loud enough you can just hear it. But imaging to confirm if there's possibly like a tumor that needs to be removed or at least monitored. So very, very interesting. Again, very rare, but just I think like it's interesting that tinnitus is just, it's so more than just this one thing. And I think that's another reason why if you ever, I had 2 patients this week and it was only Wednesday tell me that, well, there's nothing that can be done about it. And so just know that there is, there is things that can be done about it, whether it's subjective and something like, tinnitus retraining therapy could be beneficial, or maybe if you do have something more pulsatile or of concern where we need to maybe get you seen by an ENT or someone to do some imaging to kind of rule out some different possibilities. So that's my little like tidbit that I have to share.
Yeah. It's funny because I'm sitting here as the seasoned audiologist, and they tell you that when I was in school, they tell you that at a certain point in your career, you will look into somebody's ear and like see a bug or a spider or something like that. So don't freak out because you don't want to jump out and scare the patient, right?
Mm-hmm.
It's the same thing. So as you were explaining objective tinnitus, I have been there. And so when I used to work with a neurologist out in California, one of the things that I heard was this objective tinnitus. I was able to lean over and I could hear this buzzing sound coming from the person's ear. And when they put pressure on their carotid artery, it would get softer, like it would get much lower, and then they would let go and I would hear it again. So definitely a vascular thing. I totally agree. Also in that practice, there were lots of reports of different types of myoclonus, which is that middle ear muscle, right? Or something that is like fluttering.
Mm-hmm.
Yeah, I explained it to some people because sometimes and I even get it actually sometimes. It's like, when you are driving in the car and like the window is down on one side of the car and maybe a little bit on the other side, and you get that weird like difference of pressure, and then you feel that flutter. Well, some people have that not driving in the car, and it's like that weird flutter in your ear, and they think that it's tinnitus. And I know that when you have that myoclonus, like flutter or that muscle reaction in the middle ear, I tell my patients that it's kind of like an eye twitch. You don't have
That's
any
what I say. It's like
over it at all.
when you have the eye twitch, you feel like it's so obvious and like you can't see right, and you feel like everybody can notice it. But then when you look at yourself in the mirror, it's such a tiny little phenomenon that's usually how I explain it. Is like it's the same thing happening, but with your middle ear muscle. So it's just like
so it's just like an eye twitch, and you can't. And so I know that some ENTs that I've worked with, they recommend a muscle relaxer. So I kind of tell the patient that, like, I know that some ENTs will prescribe this if you want to go further with this. But again, I agree that the subjective tinnitus that you talked about, it's a lot more like physiologic, right? There might be something going on, or that something can be that needs to be looked at further. So I'm glad that that's something that you brought up today, because it's really important. And again, during Tinnitus Awareness Week, it's really important to know some of these things. And I think that it's really interesting. But yeah, I've been able to hear an actual tinnitus, as well as I've known that a lot of people that have come through my door in the 28 years or so that I've practiced, there have been multiple myoclonus incidences.
I saw one like that at our previous office, and it was a patient where they had noticed that if they hold their mouth open, they could hear it louder. And so they were embarrassed to like tell me about it, because it's like, okay, I have this clicking, but if I open my mouth, it gets louder. And so I'm like going over there, and listening, and I could hear it. And it was very much a clicking sound. And I think it was more of a myoclonus, but the patient presented with the concern of tinnitus that gets louder when they open their mouth.
Wow.
So it was interesting.
Interesting.
It is interesting. All right. So let's shift to help now. So resources and information to help with tinnitus. So Dr. Galloway, why don't you go ahead first with what you found?
So one of the things I was going to bring up is just different apps. There are different therapy apps that can be used to help with tinnitus. like if you have trouble falling asleep and you've taken your hearing aids out and you need some sort of like a sound generator. The one that I have on my phone that I've used like when I'm at a hotel or whatever is called Widex Zen. And it has like this bubbly sound that's kind of different. So it has like some low frequency ones that are kind of good. But that's one thing that I like to bring up for patients is now our iPhones can do that kind of stuff on its own. Like I know the iPhone has broadband noise, but this kind of lets you make your own, noise recipe. And a lot of times it has timers and things like that on it. So that's my resource is I like that app. I think it's kind of fun to play with.
Awesome. All right. What about you, Whitney?
Well, I think we're going to talk about it, but it is like the tinnitus, American Tinnitus Association, that website. It has some tools that in my class, we were able to like look at. One thing that I've been told is that you don't want to like over mask your tinnitus. And so things like, noise, as long as you're using it appropriately. I know at one point we were talking about the fried chicken noise isn't maybe the best because we're associating something with that noise. And so I also like using, I don't know if you guys have ever heard of the Hatch alarm clocks. They actually have some pretty good noise that you can use. And so if you're in the market for a new alarm clock, that some of them I do think have some, if you're affecting your sleep, I do think. I personally sometimes have tinnitus at night. And so turning on my fan or something like that can just help just kind of fill in that space of like, oh, I'm hearing this tinnitus, but I'm just going to try to ignore it and go to bed. So, yeah.
Yeah. So I'll kind of touch upon both of those. So yes, you don't want to mask your tinnitus. So whatever you're using, because if your brain can never identify it, it can never learn how to ignore it. And so if you cover the tinnitus completely where you don't hear it at all, then your brain will never learn how to habituate or desensitize to tinnitus. So that's the reason why. Same thing with the type of noise that you choose. You don't want to have any meaning or any patterns, because even as you're sleeping, your brain is picking up on those patterns and meaning. And so it allows for better habituation and desensitization if you have something that kind of blends with the tinnitus and doesn't have a meaning to it, to excite like that higher level of brain activity while you're sleeping. So I would totally agree with that. And then I guess for other resources and information to help out with tinnitus, we put the website on the screen. We put the website in the comments, as well as for the tinnitus retraining therapy, how to find a provider that does that. But honestly, like, do what we're doing, get involved, talk about it. You can share this show out. You can share the link. Some of our colleagues have also done some great YouTube videos as well during this week. And, you can share that out as well, but just kind of share that information to your friends on social media platforms. You can support the tinnitus organizations as well, not only during this week, but at any time. So the American Tinnitus Association is one of the big ones. And so you can consider making a donation. You can consider raising funds. Another colleague of ours had a tinnitus summit. And I think that he had, I saw that he had tried to raise $1,000. Well, during that tinnitus summit, he raised over that. He raised over $2,000 and is going to donate it to the American Tinnitus Association. So kudos to him. You can just, again, engage in dialogues. A lot of people who might think that they have bothersome tinnitus, it might be good to know that there are other people out there that have it as well. So engage in dialogues. I share that people that have normal hearing also have tinnitus. So that's also good to know and to share and to talk about it out loud. And then the last thing that I was going to share here are hashtags that are being promoted during this week. And so if you want to if you're making a post, you can use these hashtags, or if you want to search about something during this week or to look back at it, hashtags are for searching. And so if you were to put in a social media channel one of these hashtags, like hashtag tinnitus awareness or hashtag hear the noise or whatever it is, you would find people that are using these particular hashtags and talking about tinnitus, and you might actually learn something as well. So don't forget, hashtags are not just something to do and something to have that looks cool in your social media posts, but people use it because it's actually a search engine. So that way you can put that in there and you can find out more about tinnitus support or tinnitus research or about other things that people are using these hashtags during this week. And, you know, even if you're coming back to the topic later on, these hashtags will still be attached to these social media channels and whatever is going out using these hashtags. So you can always use it as a search later. So we wanted to put these up here so that you could search these hashtags, use them in conversations if you are going to post something on a social media channel. But yeah, we just wanted to make sure that you knew that. All right, so we will be back next week, and you'll want to tune in, share this out, and thanks for watching, guys.
Thank you.